Okay, everyone, welcome. We are going to get into chapter 1. And in this chapter, we will discuss and explain the role of pathophysiology in the diagnosis and treatment of disease. We will then get into some terminology that's appropriate to use when we talk about pathophysiology. We will then describe the common cellular adaptations, and then we'll list some of the common causes of cellular damage, and then we'll discuss the common types of cell death. So let's look at health and disease, okay? So when we look at the term health, what comes to mind, right? If we think about health generally speaking, in everyday language, right, we would ask someone, hey, how are you? How are you feeling today? And they go, hey, I feel good, right? So most people, when they think of health, they think of them feeling good, being asymptomatic, right? And that if you feel bad, like if you have a headache or you have a fever or you have a bellyache and you don't feel good, then you think you're sick. And that's not entirely true. In fact, many times it's the opposite. Many times when you're asymptomatic, something can be wrong. And usually when things are symptomatic, things are going well, right? So it really depends on how you define health. And simply speaking, simply being put, when a body is doing exactly what it's supposed to be doing in harmony, that's health. And then disease would be when the body is supposed to do something and it doesn't do it, it's in a disease state, right? That's being simply put. Here, health is the state of physical, mental, and social well-being, not just the absence of symptoms. And that's really, really important, right? So it makes us look at, when I'm with my patients, right? When I'm with my patients, I don't ask them the common question of, how are you feeling today? It's very misleading. So I'll say, how are you feeling and functioning today? Right? That's a whole different concept, because now they're thinking, well, how am I functioning? Well, what do you mean by that, doc? Well, I mean, how are you functioning? How are you functioning physically? How are you functioning emotionally? How are you functioning in social environments? Right? It's not just about your visceral health. How is your heart? How is your lungs? How is your stomach? Right? It's physical, mental, and social well-being. And this can vary amongst individuals, right? There are genetics that play a difference in one's health. We know that there are certain issues that can attack females versus males, especially in terms of autoimmunity, tends to affect females more than males. We know that genetic differences in terms of being predisposed, having some disposition in your genetic makeup. There are some people that may have, some women that have a BRCA gene that indicates that their weakness is now going to be in the female reproductive organs, especially in the breast, in terms of breast cancer. So what affects and has influence on the genetics is epigenetics, which is the third bullet there, environmental influences. Environmental influences means not just external environment, like is someone working in a beauty salon inhaling hairspray all day long, or working as a mechanic, breathing in a lot of the chemicals and oils and sprays that go along with engines and mechanical exhaust, right? That's external environment, but also internal environment in terms of nutrition, food, exercise. All of that can influence genetics, and we call that epigenetics. And your life experiences also have and play a major role on your physical, mental, and social well-being. All right, let's look at disease. Now, disease is deviation from the normal structure and function of a body part, organ, or organ system, or any combination of these. Now, that should sound a little bit familiar to you, right? Deviation from the normal structure and function. So, what comes to mind when you hear structure and function? You should be thinking anatomy and physiology. Absolutely, right? When you talk about normal structure, that's anatomy. When you talk about function, that is physiology. So any deviation from the normal structure, right? If you have good structure, the body is functioning at ease. And when you deviate from normal structure, it's in dis-ease, not in harmony anymore. If you have poor structure, things can't function normally. So you have abnormal function or dysfunction. Good structure, good function, poor structure, dysfunction. But that's in any body part, any organ system, or any combination of these. Diseases develop when there are significant changes in the body, and homeostasis cannot be maintained without intervention. So what do we mean by that? What is homeostasis? Remember, homeostasis is not, it's balance, yes, but it's a dynamic state of balance, right? It's not just heart rate or pulse rate being static, or blood sugar being static, or blood pressure being 120/80 all the time, or your respirations being, 14 respirations per minute. If you're running, your heart rate's going to be faster than 72 beats per minute. Maybe it's going to be 90, maybe 100, maybe 120. Maybe if you're exercising intensely, 150 could be your heart rate. And then when you're sitting still, maybe it goes back to its resting heart rate, 70 or so. Right? So homeostasis is when your body is in this dynamic state of change, and when your body fails to adapt, that's disease. Okay? If we look at this spectrum, this is like an illness-wellness continuum. You'll see that all the way to the right, there's this high level of health, high level of wellness, and a score of, over 9 to 10, where they have 100% function. They're continuously developing. They are the active participant in health and wellness. They're proactive. They make good decisions. They eat well. They think well. They move well. They're not just reactive. They're proactive. They don't eat well to prevent disease. They eat well to promote wellness. There's a difference. They don't exercise so they don't get heart disease. They exercise because it's the healthier decision for them. They don't eat organic foods so that they don't get cancer. They eat organic, homegrown, locally grown foods because it's the right healthy decision in terms of being proactive. That's around 9 and 10. 7, 8, 9, they're in good health. Regular exercise, good food, there's wellness education, there's minimal nerve interference in the neural system, right? A lot of people don't really talk about neural interference. However, it's really important to have good nerve supply because the brain is sending information down your spinal cord to the nerves, to the organs and the cells and the tissues of the body. And if there's interference to that If there's blockage in the central neural system, either afferent or efferent pathways, then optimal health is compromised. Okay, so that's really important to consider. Now, around 4, 5, and 6, there's neutral. We'll consider that to be neutral. Why? No symptoms. Nutrition, sometimes it's good, sometimes it's bad. Exercise, maybe they'll make it to the gym, maybe not. Maybe they'll go for a walk or a bike ride, maybe not. It depends. There's very little self-discipline here. Their health is really not a high priority. Then we start getting in that 1, 2, and 3 area where there's poor health. There's symptoms. People are on medications, drug therapy. They often need surgery due to neglect. They're starting to lose normal function. And then you're down in the 0, 1 where there is disease. Multiple medications. People are a polypharmacy. There's poor quality of life. The potential of that human life becomes very limited, and the body has limited function. As the structure breaks down, so does the function. So there's a big difference between 0 and 4 to 5 where you're in the disease process, right? The disease may not be there, but it's in the process. It's developing over time, whereas that 7, 8, 9, 10, you're in this area of developing wellness. Okay? Normal values occur within a range of values and may vary depending on technology used for measurement. We use a variety of things, right, to gauge certain outcomes as an outcome assessment. Sometimes we'll look at blood pressure. There's a normal value for blood pressure, and there are certain adjustments that need to be made based on the person's age, right? We know blood pressure will go up with age. We know pulse and heart rate. We know babies have a faster heart rate, a lot faster than adults. Temperature is something that we can take, the respiratory rate, all of these things we have to make adjustments for. Even gender, we mentioned that females have more autoimmune conditions than men. That's what the AI stands for, autoimmunity. Genetics play a degree. We mentioned earlier the BRCA genes means that women are at higher risk, certain women are at higher risk for breast cancer. It's not a guarantee of breast cancer, it's just a genetic predisposition. And based on the epigenetics, it can express itself as a disease or maybe not. Environmental influences, internal and external. Internal has a lot to do with your thoughts. We always talk about having healthy thoughts, happy thoughts, stop the stinking thinking. And external influences, temperature, physical stresses, emotional stresses, chemical stresses, all have a major impact. And activity level. The more active you are, perhaps the lower the heart rate or lower the pulse rate. There are certain things that are important. There are several steps in order to be healthier. One of them is be a non-smoker, right? Avoid first-hand smoke and also second-hand smoke, right? If I'm the smoker and I inhale, that's first-hand smoke. When I blow it out and I blow it in someone else's face, they're taking in second-hand smoke. That's just as dangerous. And then there's third-hand smoke. Third-hand smoke is the smoke that comes off the skin if you shake someone's hand, if you hug someone and that gets on your clothes and you absorb it through your skin. That is third-hand smoke. There have been studies done on the umbilical cords of women who were pregnant when they delivered and they cut the umbilical cord. They found atherosclerotic plaques on the umbilical cord from women exposed to second-hand smoke. Isn't that amazing? So keep that in mind. Eating vegetables, right? 5 to 10 servings of vegetables and fruits a day. It's important to eat foods that are higher in fiber. High fiber foods are very helpful in decreasing colon cancer rates. Fiber inside the gut, if you remember back to anatomy and physiology, it helps remove excessive cholesterol. It removes toxins from the gut so that you don't reabsorb them. Consuming foods that are low in trans fats. Having fatty foods are important, but you want to make sure it's the right type of fat, right? No one's ever going to tell you stay away from olive oil, right? That's a fat, but it's a very, very good fat. No one's going to say, hey, they're not going to shame you for putting avocado in your salad, right? Or having Greek olives. No one's going to shame you for that. So keep in mind, when we say lower fat foods, there's certain types of fat. You don't want to have foods that are, French fries, things that are fried and deep fried. Of course not. Drinking plenty of water is really important. When we say drink, you want to limit alcohol to about 2 drinks a day, but you also want to drink water. And the general rule of thumb is you take your body weight, you cut that in half, and you drink that in ounces. Okay, and it shouldn't be distilled water. Never drink distilled water. It should always be mineral water. If you drink distilled water, then that water goes in you and it's going to be looking for minerals and it's going to pull them out of your tissues. Okay, you always want to be drinking water with minerals in it. That's how it's found in nature, after all. Physical activity on a regular basis. It's important to help to maintain body weight. And when we say body weight, remember, stepping on a scale, if a scale says 200 pounds or 250 pounds or 280 pounds, it doesn't mean that the person is fat, right, or obese. Because I'll give you an example. I can have a glass of water, 8 ounces of water, and I can have 8 ounces of soda. Now, you put them on a scale, they're both 8 ounces, they both weigh the same. But one of them is healthier than the other. So keep in mind that when we talk about body weight, you have to look at, well, what percentage? We're really talking about body composition, right? What percentage of that body is lean mass or muscle mass, and what percentage of that body is fat mass? Fat cells, or adipocytes, are highly metabolically active. They can release inflammatory cytokines. So being obese or morbidly obese, having more fat cells can make any inflammatory disease worse because the fat cells release inflammatory cytokines. You want to be careful with the sun. Getting some sun is important due to vitamin D production, but an excessive amount of sun could be dangerous, and we have to be careful with the UV ray damage to the basal layer, and we don't want to get basal cell carcinoma. But some sunlight for the mean erythrocytic dosage is important because you can make these vitamin D precursors, and that's with sun on your face, your shoulders, your lower legs, your arms for about 15-20 minutes. That's about it. You can probably make 15 to 20,000 international units of vitamin D in a very short period of time. Follow the cancer screening guidelines. Right, there's certain guidelines. Women should go for mammography, colonoscopy after a certain age, prostate exams for men, pap smears for women, visiting the dentist frequently, right, every single year. The dentist is a great doctor to look at the mouth, to look at normal states of health. Typically, the tongue, the teeth, the gums. A healthy mouth is a healthy individual. When you see healthy teeth and healthy gums, healthy breath, healthy mouth, that's a healthy individual. when we see teeth that have rot or decay or unhealthy gums and breath that has an odor, these are indicators of a person that is not in their healthiest state. Follow the health and safety guidelines at home and at work whenever using and storing or getting rid of these hazardous materials. Pathophysiology defined: functional changes in the body as a result from disease. That's pathophysiology, right? You have to know physiology to know pathophysiology. So you just look at that word, pathophysiology. It's functional changes in the body as a result from a disease. We have to use the knowledge of our basic anatomy and physiology. It includes aspects of pathology, which describes the structural changes in the body tissues that are caused by the disease. Cause and effect relationships, defined by signs and symptoms. Okay, now we have to know what signs are and what are symptoms. So when we talk about signs and symptoms, if someone comes into my office and they say, "Dr. Lindner, I don't feel well," and I say, "What's the matter?" And they say, "Oh, my shoulder hurts me so bad, I can't even move it. It's aching me so bad." Okay, so the symptom is their shoulder hurts and it's aching. Now, signs are things that I, the doctor, have to do to try and quantify what the patient told me. So they told me that perhaps on a scale of 1 to 10, it was an 8 in pain. Now, I have to try and objectify that. Are they telling me the truth? Are they looking for attention? Are they looking to get out of work? Are they trying to get out of school, right? We have to quantify it and make sure the story matches. What they're telling me is accurate because I did these following tests, and here's what I found. So perhaps I take an instrument called an algometer, I push it on their shoulder, and they have pain when I push about, 2 to 3 pounds of pressure, and they go, "Ouch." And each time I do it at 2 to 3 pounds of pressure, they say, "Ouch," each and every time. But yet when I go to their other shoulder and I push with the algometer, which is a pain meter, I could do 7 to 10 pounds of pressure before they say, "Ouch." Right? So perhaps they're telling me the truth. I can do some orthopedic tests on their shoulder to try and quantify and measure the degree of pain or destruction to any of the surrounding tissues. So signs are things that the doctor, the nurse, the physician, the healthcare provider can measure with maybe x-rays, with blood tests, with any type of testing. But the symptoms is really what the patient is telling you in their own words and trying to describe it. Disease prevention has become a primary focus in healthcare. Maintaining routine vaccination program has been very important. Participation in screening programs. There's community health programs. And then regular routine doctor visits is really important. Visiting the dentist a few times a year. Going to the dermatologist any time you see something on the skin that you feel wasn't there before, whether it's painful or not painful. Going to the gynecologist, going to your chiropractor, going to the optometrist. It's important to have a healthcare team, right? If you think about it, most people have professional goals and they have a plan to get there. Most people have financial planners or retirement plan and they have goals and a way to get there. In terms of health, most people don't really have a full team of people to help them and guide them. New developments and trends. Constantly updating of information and knowledge is really important, right? Staying connected, learning about improved diagnostic tests are really important in the healthcare field. Learning about the latest medications and drugs that are coming out, but also learning about the drugs or medications that we have to be aware of that have DINs, which stands for drug-induced nutrient depletions, drugs or medications that have these new black box warnings that we have to be careful of. New technologies. You have to join state organizations, even international organizations, and they keep you on top of the latest conferences, or subscribe to certain journals, continue with your CE, your continuing education credits. Very, very important. I mean, every 3 years, I think my state requires me to get 36 hours of continuing education credits. I'm always going well above and beyond that because I enjoy education. I enjoy academics. I enjoy being scholarly and learning, not just for me, but so that I can be a greater assistance to the patients I take care of. Extensive research in the effort to prevent, control, or cure many disorders. All right, so right here is a good place if you want to pause, go back, and listen to this lecture again and just review this information. Okay? I'm going to go on with more information, but this may be a good place for you to pause before going on. Let's talk about the language of pathophysiology. The disease process. When we talk about disease process, diagnosis is an important term. It's the identification of a specific disease, and this is determined by signs and symptoms. The patient comes in, they tell us what's wrong, we document it, we observe, we listen, we look, we do our exam, we measure things, we look at signs, we do lab tests, we do blood work. Maybe there's cultures, x-rays, MRIs, CAT scans, and then a diagnosis is created. And it can change if a sign isn't there. It can also be different if the patient doesn't give you a particular symptom, right? So you have to have all of the information to be accurate. Etiology. Causative factors in a particular disease. That's an important term, not just diagnosis, but etiology, right? You know you're going to see these terms on the exam, so it's important to know these. There could be many causes, right? It's not just one, it could be several things. It could be congenital, meaning something at birth or at least something that happened during the development. There are many mothers who have a folic acid or a benign metabolism issue. And if they have this MTHFR mutation, this methylene tetrahydrofolate reductase flaw, then the baby's development is going to be malformed and maldeveloped, and the baby may have cleft palate or hair lip or spina bifida. Right, so MTHFR is a pretty huge thing. This is why a lot of women are given folic acid, but there are women who are given folic acid in which the babies still get these syndromes. So it led us to believe that folic acid isn't the right form, but to give the mom benign in the methylated form. So it's methyl tetrahydrofolate is better. There are microorganisms, such as infections. There's immunological dysfunction, like autoimmune diseases. There's degenerative diseases, DJD, which stands for degenerative joint disease, which is the same as osteoarthritis, OA, and also trauma. So, again, the etiology can come from a variety of factors: congenital, microorganisms, which result in infections, immunological dysfunction, like autoimmune diseases, degenerative diseases, and trauma. Etiology is sometimes referred to as idiopathic or iatrogenic. Idiopathic means unknown, right? They shrug their shoulders, we don't know. Iatrogenic can be caused by the treatment. It can be caused by the procedure. It could be an error in a hospital. Iatrogenic is induced by the physician, the doctor, the hospital, the treatment, or the procedure. That's iatrogenic. Predisposing factors, the tendency that promote development of a disease in an individual. Age could be a predisposing factor. The older a person is, more likely of them to develop hypertension. Gender. Females are more likely to get autoimmune diseases. Occupational. Someone who was working in the toll booths for many, many years, likely to develop respiratory issues and asthma. People who are working in a hair salon with a lot of sprays and chemicals, also respiratory issues. Diet can predispose the person to a lot of diseases. If they consume processed foods, things that are prepackaged, high salt, high sugar, refined carbohydrates can trigger diabetes. Prophylaxis. This is a measure designed to preserve health and to prevent the spread of disease. Prophylaxis, right? We've heard of condoms. Condoms are prophylactic because it can prevent pregnancy, but also at the same time, it can prevent sexually transmitted diseases, STDs. Some people have heard, oh, my grandma or grandpa takes a baby aspirin a day, right? They try and do that to prevent coronary artery disease, to keep the blood nice and thin, to keep the blood very, very thin. Okay. Prevention is measures the design to prevent a disease. Vaccinations has been historically linked to prevention. Diet, especially the Mediterranean diet today, is getting lots of attention. Even the ketogenic diet is getting lots of attention. Vegetarian diets get a lot of attention. And exercise. Let's look at the characteristics of disease. Pathogenesis is the development of a disease. Just look at the word pathogenesis. Genesis is to create, right? Pathogenesis, development of a disease, considers the sequence of events. That's really important, like the path of it. It considers the sequence of events involved in the tissue changes. Now, if we look at the disease onset, there can be acute onset or insidious onset. If it's acute, it develops quickly. Bam, it just comes on. There's marked signs, they're short term, they don't last for a long time. It's just wham, right? Like overnight, super quick. Compared to insidious is gradual. It's a gradual onset, it's slower. If we look at acute disease, again, it's a short-term illness. It develops fast, and there's marked signs like the pain comes on super quick. The fever just came on, right? Pain and fever, and pain in the right lower quadrant, acute appendicitis, right? Chronic disease, it's milder. It develops over time. The degenerative joint disease or the osteoarthritis took place over years. They just didn't wake up with bone spurs in the heel or bone spurs in the vertebra or disc degeneration in their spine. They didn't wake up with that disc herniation. It happened over the course of 10 to 15 years. It develops over time. Now, there are some more characteristics of disease. This is still in the line of language of pathophysiology. Let's look at subclinical. There's pathological changes, okay, but there's no obvious manifestation of it. It's subclinical. A classical example of this would be the kidneys, right? The kidneys can take a big hit. They could take on lots of damage before the person becomes symptomatic. The latent stage is there's no symptoms or clinical signs that are evident. This is when the virus is kind of brewing and it's multiplying. It's seen in infections during the incubation period, right? The incubation period is the time of the exposure to a microorganism and the onset of signs and symptoms. The prodromal period, that's the early part of the infection, right? It's the early development of a disease. The signs are nonspecific or they're absent, such as fatigue, right? When a person is kind of like, they're just not feeling too well, okay, it's really not specific. They're a little bit tired. Oh, do you want to eat something? Oh, no, I can't even think of a food. I have no appetite. Maybe they have the chills or they have fever and they're a little bit achy. When we hear the term manifestation, now there is clinical evidence of a disease. It manifests. The local manifestations, right? If you have a local manifestation, that's like something at a given area. You sprain an ankle, the inflammation is right there at the ankle. You get stung by a bee in your forearm, it gets hot, red, and swollen right there in your forearm. That's localized, compared to something that's systemic. Systemic, these are general findings throughout the whole body. The fever that makes your whole body achy, it affects everything. I mentioned earlier signs and symptoms. Signs can be measured or observed, right, quantitatively, like blood pressure. Let's say someone has a headache. They have such a headache, they're holding their eyes, the frontal lobe, and I'm just suspicious that maybe their headache is due to high blood pressure. So I have to be thorough. Let me take the blood pressure in their left arm, and it's 170 over 110. Huh. That didn't seem right. Well, let me double check it. Let me do it again. 175 over 112. Huh. Let me check the right arm. 175 over 110, right? Now I'm starting to get consistency. So the headache is a symptom secondary to the high blood pressure, right? Now, if someone just says, oh, take an aspirin, take a Tylenol, do you see how sometimes covering up acute problems and these things become chronic could really lead to serious issues down the road? Symptoms are subjective. It's the feelings perceived by the patient or the individual, like a headache or a pain. But I could use an algometer to kind of quantify that. That would be a sign to try and quantify it. Signs are objective. Symptoms are subjective. Okay? The lesion, any local change in the tissue, right? Any local change to a tissue is called a lesion. It can be microscopic or it can be visible in the body. What about a syndrome? It's a collection of signs and symptoms. I deal with, a lot of the times in my office, subluxation syndrome, vertebral subluxation syndrome. It is a collection of signs and symptoms where a patient has kinesio-pathophysiology, where they're not moving well. They have myopathology, where the muscles are now dysfunctioning. They have neuropathology, where now there's neurological compromise. They have histopathology, where there's inflammation and heat coming from the body. And so all of these things combined together is a syndrome. We have acquired immune deficiency syndrome, AIDS, PMS, premenstrual syndrome. So a syndrome is really a collection of signs and symptoms. And it often can affect more than just one organ. Diagnostic tests can assist with the diagnosis, and it also helps us monitor a response to treatment. So if I am taking someone's blood pressure and I give a particular treatment and I want to see if my treatment worked, I would have to do a post blood pressure check after the treatment. If they're having problems with breathing and I check their lungs with a spirometer, I would do it before and after and look at the measurement pre and post to document success of the treatment. If their blood sugar was high and we put them on a specific diet, and then we look at the blood glucose levels and the insulin levels and the hemoglobin A1C levels, we do it before and after several weeks of care to see if it's working. So this includes blood tests, biopsies, cultures, any type of radiograph can be used. What is a remission? Well, a remission is the manifestation of the disease subsides. It goes away or it's absent. This is pretty common in many autoimmune diseases. We'll see it, for example, with multiple sclerosis, where a patient may have these symptoms and then they could disappear. They could disappear for almost a decade and then come back. Exacerbations, a worsening in the severity of a disease, right? So a remission, it subsides. An exacerbation, it gets worse. Precipitating factor, condition that triggers an acute episode. Like someone comes in to my office, they were shoveling snow, and all of a sudden they have chest pain. Well, the shoveling of the snow caused angina pectoris. Maybe it's creating a heart attack in that individual. Complications. These are new secondary or additional problems. Like the person has a skin lesion and it wasn't properly cleaned, it wasn't hygienic, and now they get a secondary infection. Years ago, I had a patient who was diabetic, but he didn't know he was diabetic, and pretty large guy, wouldn't take off his sneakers or socks in the world to have me evaluate his feet because it was too much work for him to put them on and get them off. That's how large he was. So anyway, I saw that his lower leg had a pretty bright red rash on it, very, very hot to touch. So I took my pen and I outlined the redness with a black pen, and I said to him, if this redness over the next few hours goes outside of the circle that I outlined on your leg, you need to go to the hospital. Otherwise, I will see you in 2 days. And 2 days passed. He didn't show up in my office. Reached out to him. He did take himself to the hospital, and he had an infection. And he had a minor lesion between his great toe and second toe. There was an infection. It got in through the skin into the bone, and he had a bone infection. And they thought they may have to amputate his leg. Thank goodness they didn't, but he did lose his great toe. So that was a complication. Therapy. Treatment measure to promote the recovery. What did they do? They had to give him IV antibiotics for quite a while. Treatment measure to promote recovery or to slow the progression of the disease is known as the therapy. The characteristics of the disease continued. A sequelae is an unwanted outcome of the primary condition. So let's say a patient had a stroke. The sequelae of the stroke could be hemiparesis or paralysis on half the side of the body, or the stroke was on the left side of the brain and to the Broca's area, and now they have loss of speech. Okay? Convalescence, that means the period of recovery. Prognosis means the probability for recovery or other outcome, and these are based on average outcomes. So we know that if someone has a runny nose or the rhinovirus, in 7 to 10 days, they'll be better. Compared to pancreatic cancer, that's pretty painful. Prognosis is typically 6 months to a year. And the outcome and the prognosis is pretty poor for pancreatic cancer, unfortunately. Morbidity. Morbidity indicates the number of people with a disease within a group, right? Such as the number of people with the flu. That is the morbidity. It indicates the number of people with a disease within a group. Mortality indicates the number of deaths resulting from a particular disease within the group, right? So what's the number of people that die each year from the flu? That's the mortality. Autopsy is performed after death to determine the exact cause of death. It's a post-mortem examination. Epidemiology is the science of identifying the causative factor and tracking the pattern or occurrence of a disease. There are epidemiologists. These are people who have these very, very high degrees, and all they do is track diseases. They track infections, they track viruses, they work for the World Health Organization or the Center of Disease Control, the CDC. So epidemiology is the science of identifying the causative factors and tracking the pattern or occurrence of a disease. Now, you can track by incidence or prevalence. So the incidence is the number of new cases in a given population within a specific time period. That's the incidence. The prevalence is the number of new and old or existing cases in a specific population within a specific time period. Okay, there should be a picture coming up of this, right? So incidence, the number of new cases in a given population within a specific time period, and prevalence is the number of new and old or existing cases in a specific population within a specific time period. Prevalence. Epidemics. Epidemics and pandemics, two very, very common terms. Epidemic occur when a higher than expected number of cases of an infectious disease occurs within a given area. Okay, we can talk about a flu epidemic. A pandemic involves a higher number of cases in many regions of the globe, right? We've heard that COVID is a pandemic. It's around the globe, not just within the United States, but it's traveling. Now, I've heard that there's a lot of literature out there that talks about a syndemic, and that COVID, and I happen to be in alignment with this, is more of a syndemic compared to a pandemic or even epidemic. So a syndemic or a synergistic epidemic, right? That makes a little bit of sense. It's the aggregation of two or more concurrent or sequential epidemics or diseases that cluster in a population with biological interactions which exacerbate the prognosis and burden of the disease. Right? Addressing COVID-19 means addressing diabesity. Now, what is diabesity? It's diabetes and obesity combined. Right? There's a term, maybe you've never heard it before, but it's called diabesity. Hypertension, cardiovascular disease, cancer, chronic respiratory diseases. We know that diabesity or obesity and diabetes is an epidemic. Hypertension is an epidemic. Cardiovascular disease is an epidemic. Cancer is an epidemic. Asthma, chronic respiratory disease, these are all epidemics. So when you have these, think of it as these pre-existing conditions, now we have a syndemic. Okay, so COVID is really a syndemic. Here is that picture that we were showing you before. The incidence, the green line here, if we look at the number of cases in 100,000 population going upward, and then the time factor is going horizontally left to right, right from 0 to 12 months. So the incidence of new cases, that's here in the green. And if you look at around May, June, somewhere around here, if you look at the prevalence, which is the large increase in cases, right? This is now the number of new cases and old cases combined right in here. So incidence, prevalence. Communicable disease, infections that could be spread from one person to another. HPV, human papillomavirus, is spread from one person to another. There are some strains that are benign, some malignant, some could be precancerous. And then notifiable or reportable diseases, these are diseases that must be reported by the physician to certain designated authorities, like chlamydia, gonorrhea, I've tested patients where these tests have come positive, and we have to let the Nassau County or the state and county health department be well aware of this, especially even hepatitis. Okay, so here's another place where you may want to pause, take a break, and then come back. If you feel fresh and you want to move on, then hang on. Let's look at cellular adaptations. Cells can adapt their growth and differentiation to a variety of altered conditions. Now, cells can modify, they can adapt, they can grow, they can differentiate, and it depends on maybe hormones. What does growth hormone do? Right? Growth hormone can have an influence on cells and tissues. Environmental stimulation. What's going to happen to my cells when I exercise? What's going to happen to my muscle mass when I exercise? What's going to happen to my muscle mass if my arm is in a cast and I don't do anything? Will it atrophy? Will it waste away? So irritation, decrease in nerve supply as seen with spinal subluxations. There was a Dr. Sue who did these studies many years ago and discovered that when a nerve was pinched, and I believe they may have used animal studies for this, again it was many years ago, they saw that within 3 minutes time cells started to change their shape in 3 minutes. And that's just the weight of a quarter. The weight of a quarter on a nerve. You know how much a quarter weighs. So the weight of a quarter on a spinal nerve, after 3 minutes time under a microscope, they were able to see cells change their shape. Now if they change in their shape, that means their structure changes. What happens to their function? They start to dysfunction. Changes may be reversible after the stimulus is removed. Disease may result if a cell structure and function change and disturb homeostasis. We talked about this in one of the earlier slides early on. Now you heard me use the word atrophy before. If a muscle isn't getting its nerve supply, if there's a subluxation or nerve interference from C5 in the neck and it's not getting out to my bicep muscle can actually atrophy. It can decrease in size. So when you have cells that decrease in their size, which will result in tissue mass decrease, we call it atrophy. This can happen if a person is malnourished, if they're not getting enough nutrition or protein in their diet, and they're not breaking down the protein to amino acids, then their muscles, their tissues, and bone mass can start to break down. Atrophy can happen if there's not enough neurological stimulation. It can happen with spinal subluxation without proper nerve supply. Things can degenerate and break down. What if a person broke an arm and the arm is in a sling or in a cast and that arm isn't used? What happens to the muscles? They start to atrophy. If someone's under a lot of stress, we've seen this with individuals, right? If you think about a person, we've all seen the one person at the gym, the one guy at the gym that's big, tall, has the big belly, but has the chicken legs, right? The big upper part, but then the lower part, the legs are very thin. This is primarily a result of stress and cortisol. Cortisol is known to create big bellies, right? Fat around, a lot of adiposity around the belly region, and it breaks down muscle mass. And the largest muscles of the body happen to be in the quads, in the legs, and the hamstrings, so they start to thin out. So if you look at the picture there, you could see on the top left there, that's your normal cell. The bottom is atrophy, and to the right is the opposite of atrophy, which is hypertrophy, which is when the cells start to thicken. So atrophy on the left, no exercise, no nerve supply, poor nutrition, and all the opposite things can create hypertrophy. It's when the cell size increases, which results in enlarged tissue mass. It's caused when the tissues are working harder. So if you're exercising, if you're training and working out, it's normal for those muscles to thicken. Also, if a heart is beating extra hard to meet the demands, the cells will hypertrophy. Okay, the person can actually become very, very sick when the heart muscle enlarges. That's not a good thing, having the heart enlarge. Okay, hyperplasia, now that's different than hypertrophy. This is now hyperplasia, is when you have the increase in the number of cells. If you look at the picture on the bottom in the top row, normal cells. Hyperplasia, now the number of cells are doubling up. There's physiological hyperplasia. Now that's normal. Think of a woman's uterus during that time of month. Remember back to anatomy and physiology. There's the endometrium, the myometrium, and the perimetrium. The endometrium is that layer that sloughs off every 30 days. So normal or physiological hyperplasia, it occurs monthly in the endometrium. An increase in the breast tissue during pregnancy, right? When that's going to increase in cell number, that's normal. Pathological hyperplasia, on the other hand, that's abnormal. The example is an increase in the adrenal gland size. Remember, the adrenal gland is the suprarenal gland above the kidney. So you get the adrenal gland is becoming larger secondary to a pituitary adenoma. And now what's going to happen is you're going to be pushing out too much adrenocorticotrophic hormone. That's a problem. Metaplasia. This is a mature cell type is replaced by a different mature cell type. We see this a lot in the respiratory tract. In smokers, you'll typically have in the trachea pseudostratified ciliated columnar epithelium, right? God bless you, right? Long word. Pseudostratified ciliated columnar epithelium. And down below, you can see that you have these columnar cells and you have these cilia up here. So the pseudostratified ciliated columnar epithelium, these can burn off. These can become paralyzed with smoke. And then they start modifying and they become these squamous cells. And when you have this that starts to change to this, you get metaplasia, right? Squamous cell carcinoma. This term carcinoma, carcinogenic, it's cancer causing. Some of the causes of metaplasia, vitamin A deficiency can cause that, as well as chronic irritation, such as the chronic irritation of smoke and all the chemicals associated with smoking. Now, dysplasia, on the other hand, sounds like metaplasia, but dysplasia, when you look at this, the cells vary in their size and shape, but it's contained within the tissue. That's dysplasia. See, here's kind of like the boundary is right here. Here's the border, and although these cells are changing in their size and shape, it's not breaking through or invading into other tissues. They're still contained here. The rate of cell division is definitely increased. May be precancerous if the stimulus continuous and persists, and it could be caused by chronic irritation. It may be precancerous change associated with a pap smear. Pap is named after George Papanicolaou, the Greek physician. When they do a pap smear, they can find cervical dysplasia, and that is sometimes associated with the human papillomavirus, HPV. In certain instances, it's seen post-oral contraception. Many women are on the OC, the oral contraceptive, and it does have a drug-induced nutrient depletion where it depletes B9 or folic acid. And when that happens, cervical dysplasia is seen. They have found changes in cervical dysplasia in about 3 to 4 months when methyl tetrahydrofolate is taken. Several months later, the folate levels, the B9 levels are checked. They go way up. And they go back, they do another PAP, and they see that it goes back to normal cells. So something to consider. It could be a folic acid or B9 issue that's creating the cervical dysplasia, or it could be human papillomavirus as well. What is anaplasia? Now, anaplasia is undifferentiated cells with variable nuclear and cell structures, and here they start to invade other tissues. Remember, in this picture, it was contained. Here, it starts to invade. Okay? The characteristics of cancer cells: neoplasia, new growth. Neoplasia means new growth. Sometimes we refer to that as a tumor. Okay? Again, good place to pause. If you want to take a break, you can pause, or we can go on. Let's look at, now we're into cell death, cell damage. We talked about adaptations a bit. Let's look at cell damage and necrosis. So this term here is ischemia. Ischemia is a decreased blood supply to a tissue or organ. When there's decreased blood supply to a tissue or organ, that's usually secondary to some sort of blockage or a circulatory obstruction. It's going to result in hypoxia, right? So hypoxia means decreased oxygen. Now, what happens if you have decreased oxygen? Well, the mitochondria need oxygen so that they can work with the Krebs cycle and the electron transport chain to make ATP, adenosine triphosphate, or energy. So you have decreased energy, then what's going to happen to the body's ability, the mitochondria's ability to make ATP? So less ATP. Now remember, ATP is needed to run the sodium-potassium pumps, right? The sodium-potassium pump needs ATP. So the sodium-potassium pump stops working. And we start to get an accumulation of these metabolites, of these electrolytes, like sodium and potassium. We start to get concentrated sodium and potassium within a cell. And when you have these electrolytes or these minerals inside a cell, water always follows sodium. Think about if you eat salty potato chips or salty pretzels. Anything with salt usually makes you drink water. You get thirstier. So salt and water typically go together. So if you have sodium concentrated inside of a cell and water follows it, the cell is going to swell. And now the cell switches to anaerobic respiration. And the cell starts to become acidic. And the cell does not function well in an acidic environment. Some of the causes of cell damage: physical agents, excessive heat or cold, radiation can also cause cell damage, mechanical damage, pressure or tearing of tissues, and then toxins. Whether they come from the external environment, we call that exogenous toxins, or endogenous toxins from inside the body. Exogenous toxins from the environment, stuff that you breathe in, food colorings, glyphosate that's sprayed, Roundup that's sprayed on so many crops, very, very toxic to the human body. Causes of cell damage: microorganisms, infections, bacterial issues, viruses, parasites, all can create cell damage. There's a term called pyroptosis. Pyroptosis is a type of cell death that's caused by certain microorganisms. And they create something called lysis. When you hear the word lysis, it means to split apart or to destroy, to break apart. Many chemical reactions, you remember back in chemistry, in anatomy and physiology, when you learned about breaking bonds and making bonds, we learned about hydrolysis or hydrolysis. Okay? Here we have hemolysis. Hemolysis or hemolysis is the breaking down of blood. Cellular enzymes can leak into tissues. So when you have a cell that breaks down, there are certain enzymes that are normally found in, let's say, a liver cell or a muscle cell. And when those cell membranes die, it leaks, those enzymes leak, and that can result in inflammation. Apoptosis, this is now programmed cell death. It's normal with abnormal cells. When there's abnormal cells, the body will set up a program to destroy it. It happens when there's too many cells, when there's injured cells. Happens normally with aged cells. We know that red blood cells typically live 120 days. And then after 120 days, there's a process where it goes to the spleen and it goes to the liver, and they break down, and some of the proteins are recycled, and many of the toxins are excreted from the body. Cells can digest themselves enzymatically. We know that the body has the ability from the Golgi apparatus or the Golgi complex to produce lysosomes. These are these vacuoles that contain digestive enzymes and hydrogens, and they just pump hydrogens and digestive enzymes into a foreign cell or a pathogen, and it just makes it very acidic, and then it destroys it. Cells are also engulfed by phagocytic cells without an inflammatory response. That's what's really important about apoptosis here. Cells can be engulfed by phagocytes. Remember, monocytes is a type of white blood cell that's in circulation, and when it drives or dives into tissues that have lesions or issues, they become a macrophage. Macrophages can engulf and break down unwanted cells and tissues. Neutrophils can do the same, right? That is considered phagocytic. And then if you think of the other white blood cells, like the basophils, the eosinophils, and neutrophils, remember those are the granular sites. The granulations within them that surround the nucleus, they degranulate, and they release these potent enzymes that help to remove debris from the body. Cell death is necrosis. Death of one or more cell or a portion of a tissue or organ in a living person is necrosis. It's caused by irreversible damage, right? It's not apoptosis. Necrosis is cell death. You'll look at many tissues, they start to change color, and they just start to look very, very unhealthy. When you look at necrosis, there's a few different types. There's liquefaction necrosis, and there's coagulative necrosis, and then there's fat necrosis. So let's look at liquefaction necrosis. This is when dead cells start to liquefy because the release of these cellular enzymes. This is typically associated with brain tissue death. We'll see it with certain bacterial infections. You can see it kind of looks a little bit gel-like and liquid-like in these areas. So that's liquefaction necrosis. Coagulative necrosis is when the cell proteins are altered and or they become denatured, and it causes coagulation where it becomes more firm and more rubbery. This is seen with heart attacks or MIs, myocardial infarction. So that's a coagulative necrosis. Fatty necrosis. This is when fatty tissue is broken down into fatty acids and ends up looking pretty soapy, very soapy looking. It's commonly found in breast tissue. Sometimes they're referred to as fatty cysts. And it can be seen with certain infections and presence of enzymes. Then there's caseous necrosis. Caseous, like casein, from dairy. It's a form of a coagulative necrosis that you could see here. It's thick, yellow, and a cheesy substance. This is the lung. This is sometimes seen in TB or tuberculosis. Caseous necrosis. Infarction is an area of dead cells as a result of oxygen deprivation. Now, when you have oxygen deprivation to the heart, we call it a myocardial infarction or a heart attack. When we have decreased oxygen from the vertebral arteries going up into the brain, or the internal carotid arteries going up to the brain, then we have what's called a CVA, a cerebral vascular attack, also known as a stroke or a brain attack. This is due to oxygen deprivation. Okay, I think we're getting close to the end here. Cell damage and necrosis. Let's look at gangrene. There's dry gangrene, wet gangrene, and gas gangrene. Gangrene is an area of necrotic tissue that has been invaded by bacteria. So dry gangrene is from coagulative necrosis. This is when the tissue dries, it shrinks, and blackens. Wet gangrene, liquefaction necrosis, right? We just learned that. The tissue is cold, it's swollen, it blisters, it's oozing fluid, and it's also black. Gas gangrene, this is called by the buildup of gases within tissue. Clostridium perfringens can cause it. Strep group A can cause it. Staph aureus can cause it. And it usually requires surgery or amputation to prevent the spread of this infection. Okay, so dry gangrene is from coagulative necrosis. The tissue dries, shrinks, and blackens. The wet gangrene is from liquefaction. The tissue is cold, swollen, it blisters, it's oozy, right? It's wet. That's from liquefaction. And gas gangrene is created by a lot of these different bacterias, right? Bacteria tend to give off gas. Just think of people that have bacterial overgrowth in their intestines. They get that kind of like beer belly. It's just all gassy. Their bellies feel hard, but it's the gas from the bacteria. So it can happen from Clostridium perfringens, Strep group A, and even Staph aureus. Okay, and here is a picture of dry gangrene. If we go back and we look at dry, the tissue, it's from coagulative necrosis, coagulation. Tissue dries, shrinks, and blackens. The gas gangrene, this actually sounds like, if it happens to be in the foot and they're walking, it'll sound like, like the bubble wrap when you start popping that stuff. That's what it actually sounds like. Okay, that's from the gas gangrene. But the dry gangrene, the tissue dries, shrinkens, and blackens. Here you go. You could take a look at that. Right? That is necrosis. That's necrotic. Right? Dead tissue. Okay. Well, that brings that to an end.